speak about hand hygiene and also about prevention of these CAUTIs. This slide is showing what is the best product to use for hand hygiene. It is well known that one of the best products is alcohol-based hand rub for various reasons. Amongst them is that the time factor. It takes less time than soap and water, and we know that the biggest hurdle for healthcare workers for not performing hand hygiene is we don't have much time. We don't have enough time. And therefore, alcohol hand rub is the best product, not only because of time, but also it kills bacteria. It kills the microorganism, not like soap and water. Because soap and water, it doesn't kill bacteria. It only flushes the bacteria down the drain. Now, when we speak about hand hygiene and urine catheter care, there are various steps when hand hygiene is crucial. It's important that we perform hand hygiene. And these are before inserting a urine catheter, when taking a urine sample from the sample port, when emptying a urine bag, and also because maybe we tend to forget the environment, the role of the environment. That means when touching the environment and then handling the catheter or urine bag. Now, when and how to treat symptomatic CAUTI. The patient must meet the following criteria. These are three. The first one is that the patient had an indwelling catheter that had been in place for more than 2 consecutive days in an inpatient location on the date of event and was either present for any portion of the calendar day on the date of event or removed the day before the date of event. Second, patient has at least one of the following signs or symptoms: fever, which must be more than 38 degrees Celsius, suprapubic tenderness, costovertebral angle pain or tenderness, urinary urgency, urinary frequency, and dysuria, that means painful urination. And the third criteria is patient has a urine culture with no more than 2 species of organisms identified. Because the thing is that if there are 3 or 4 organisms, it would be very difficult even for the lab to identify which bacteria is causing if there is a UTI. And at least one of which is a bacterium of 105 colony-forming units per mil. And this is from the National Healthcare Safety Network. And this is an example. This is a guideline by the National Institute for Health and Care Excellence in the UK. A guideline for when to prescribe antibiotics when a patient has a urinary catheter. I'm not going through it all because of the time, but basically the aim of this guidelines is to decrease inappropriate antimicrobial use, because as you know, we have this antimicrobial resistant problem. We have microorganisms like CRE, VRE, which are being more resistant to antibiotics. Very important that when we have to have a culture, if the patient needs an antibiotic, we have to offer an antibiotic. And obviously, we have to watch out also for adverse effects of antibiotics, because you know we can get diarrhea, we can get nausea, and also Clostridium difficile, which is antibiotic associated as well. And very important that when we get the urine culture results, we have to review the choice of antibiotic, and also we have to change it according to the susceptibility of the results. Okay? Very important as well, these guidelines tell us that considering removing, or if not possible, changing the catheter if it has been in place for more than 7 days. Right? But do not delay antibiotic treatment. Now, what is asymptomatic bacteriuria? First of all, if it's very common in the elderly, which I think it was mentioned already, and this should not be treated because of AMR. However, if there is asymptomatic bacteria in pregnant women, this has to be treated basically because 25% and more of pregnant women will end up of developing symptomatic bacteriuria. And also patients undergoing a urological procedure which is likely to result in urinary tract mucosal bleeding. Example is TURBT. Common bacterial causes of UTI, the most common is E. coli, which accounts for 70 to 95% of cases. Then there are other bacteria like Enterobacterialis, Proteus species, Klebsiella, Staphylococcus safricotocus, Enterococcus group B, Streptococcus as well. And in catheterized patients, the most common are Pseudomonas aeruginosa, Staph aureus, and even yeast. Now, what is the advice for patients if they're going to collect a clean urine sample for culture sensitivity? First of all, hand hygiene. If they are males, they have to wash their penis. If they are females, they have to wash their genitals, including between the labia, to make sure that there is no contamination. They have to start to urinate. And what's important, they don't collect the first part, but they collect the mid part. That's why it's called midstream. Screw the lid of the container shut, label the container with full patient details, very important that we check that he's the right patient, and then we end up with hand hygiene. Regarding urine sampling, very important, do not take samples from the urine catheter bags. Eva has highlighted this, that because the urine bag is already contaminated, especially if the catheter has been there for many days. And also avoid taking samples through long-standing indwelling catheters. Ideally, if you're going to take a culture sensitivity, if there is a suspicion of CAUTI, it's better to change the catheter if possible. Now, regarding sampling in catheterized patients, very important to know that bacterial occurs at a rate of 3 to 10% per day of catheterization. And 10 to 25% of these will go on to develop asymptomatic UTI. Very important to note that positive urine culture taken from old catheter does not mean UTI. We have to correlate with the clinical picture, mainly with the signs and symptoms. As I said, ideally change catheter before sampling. And also, although the urine maybe it's cloudy or smelly, this is not indicative of UTI in the absence of other symptoms and signs. Now, this is a video showing how to obtain a urine sample from an indwelling urine catheter. These are the items that you need to collect the sample. Maybe they vary from country to country.
Perform hand hygiene. Verify the patient's identity with the pathology request form and explain what you are going to do to obtain consent. Prepare all your items in a clean tray, checking expiry dates, and bring them to the patient's bedside. Expose the catheter tubing, ensuring that patient's privacy is preserved at all times. If there is no urine present in the drainage tubing, clamp it below the sampling port for 15 to 20 minutes, using a non-toothed clamp. Perform hand hygiene and wear an apron followed by gloves. Open the alcohol-impregnated swab and clean the sampling port on the tubing. Allow to dry for 10 to 30 seconds. Remove the syringe from its packaging using an aseptic non-touch technique. Insert the tip of the syringe into the needle-free sampling port at a 90-degree angle to the tubing and aspirate the required amount of urine. 10 ml are usually sufficient. Withdraw the syringe from the sampling port without contaminating the tip of the syringe. Transfer the urine into the sterile specimen container and replace the lid securely. Dispose of the syringe as appropriate. Clean the catheter port again using an alcohol-impregnated swab. Remove gloves. Perform hand hygiene, then remove the apron and once again perform hand hygiene. Ensure patient privacy is again maintained by covering the patient and perform hand hygiene once again. Affix the label with the patient's details to the specimen container. Place the specimen container in the specimen bag. Insert the pathology request form into a separate bag and send the specimen and request form to the laboratory. Document the procedure in the patient's notes.
Okay, now collection and transport of specimen. Now, very important that specimen collection techniques and transportation are critical. Why? Because if they don't arrive at the laboratory, all right, the sample may arrive soiled, for example, and therefore it can affect the results. Therefore, even the collection technique should ensure that the specimen is not contaminated with colonizing flora, which is ensured through adequate disinfection of the sampling area, as we saw in the video. It's ideally collected prior to starting antimicrobial therapy, okay, because antimicrobial therapy may lead to a false negative result. And also important that transportation of the sample is also important, as it has to reassure the viability of the possible pathogen is maintained. That the sample very important, must reach the lab as soon as possible and be transported in the adequate sampling container. What are the consequences of inadequate sampling? Inadequate sampling may give a false or positive result, which may in turn result in prolonged hospital stay due to delayed or wrong diagnosis, delay in establishing appropriate infection control precautions, which may lead to outbreaks, and even increased cost. And therefore, we have to make sure that when submitting a sample, we check the correct patient details and appropriate clinical details. Just to quote a paper, this is the role of the nurse and prevention of CAUTI. This was about the knowledge, attitude, and practice in relation to CAUTI. It was a cross-sectional study. And what does this paper contribute to the wider global clinical community? There were 3 points. First of all, nurses play a primary role in uric catheter management and CAUTI prevention, as the insertion and maintenance of uric catheters come under the scope and standards of nursing practice. Nurses' understanding of and attitude towards CAUTI prevention are considered essential for the safe practice of uric catheter care. And lastly, education intervention is necessary to improve nurses' knowledge regarding infection control practices and balance the knowledge and practice gap. Next slide, please. This is called the Houdini. Houdini was one of a famous magician, but basically, is there any hematuria? Is there any obstruction, urology surgery, decubitus ulcer, input, output, not for resus, comfort care, or mobility? If no, then simple, then make that urinary catheter disappear. Best practices that help prevent CAUTIs. And to sum it up, to recap what I said, this is a wheel, and I thank for the permission from the AHIQ in the US. But basically, we have to have an appropriate catheter care. That means indication, alternatives to urinary catheter insertion. We have to have a proper insertion maintenance intervention in terms of insertion, securement, drainage back, and even personal hygiene, and also prompt removal intervention. And very important to have to involve the families of the patient, and also we have to review for need. We have to ask ourselves, do we need this catheter? And the take-home message, once a catheter is put in place, one must keep 2 important concepts in mind. Keep the catheter system closed in order to postpone the onset of bacteriuria. And secondly, remove the catheter as soon as possible. If the catheter can be removed before bacteria develops, postponement becomes prevention. However, I have to say that the best prevention is not to use a uretary catheter at all. And I thank you for listening.